I want to introduce myself. My name is Tom Sider, and I'm purposely wearing my apron. I have my own business. It's Your Choice Snacks. And why I'm mentioning that is because in my job I have a lot of heavy lifting. I lift cases of pop. I fill pop machines. I put cases up to about 16, 17 cases of pop on a cart, and I pull it through the room. So my job is partially at the counter selling stuff and partially hauling stuff and filling machines. And I want to give you a little background to my coming to Dr. Saylor here. I had a disease in my left hip, and it was a degenerative disease. It was in the ball of the hip, and I had to have what they call core decompression. I won't go into detail, but I had the operation, and it seemed to have fixed it up, and the x-rays said that it fixed it up okay. But after a few years it started to bother me again, and I would have pain in it as I would be walking, and if I was turned a certain way I would get shooting pains. And so I was thinking that I might have to have it again. So that's where I was. I was having pains in my left hip, and then my mother encouraged me to go to a chiropractor and see what they could do. My wife did too, and I will be honest, I'm the world's greatest skeptic about chiropractors. I really didn't care much for them. And but I thought, why not? I'll go ahead and try. So I came here with my wife, and I started to have the treatments. We jokingly call it the Woody Woodpecker treatments because you use that little woodpecker gizmo on you. And for the longest time, I didn't see any improvement. And but I came, and sometimes it was like a couple times a week, and so I kept coming, and I can't say at what point or how many visits it was, but I seemed to have a less and less problem with my hip. And I can't answer it. I can't say what it's done for me. I can't say what it does or what nerves it stimulates or what, but all I know is my wife said we've been here about 2 years now, and for a long time now my hip has not bothered me. Once in a while I'll get a little twinge, but nothing like I had before, because I used to take and almost collapse on the floor. The pain would be so severe. So I don't know the scientific factor about it, but I know that since I've been coming, my hip has been feeling quite well, and any pain right now that I have is very, very slight. And I just keep coming now. I like to get adjusted once a week just to keep me tuned up, so to say. And like I say, I was a skeptic, but I see results, so here I am. I keep coming, and I hope your success will be as good as mine.